The extent of cataract that develops will depend on the amount of biochemical mechanisms that have gone into disarray. Classification of the lens, etiology-based classification. There are two classifications, etiological and morphological classification. So here I am talking about the etiological classification. Etiologically, the lens can be either a congenital or an acquired cataract. So congenital cataract I am just coming to in a bit. Acquired cataracts can be, the most common is age related or also called senile cataract. It's also called senile cataract. The next cause is a traumatic cataract, complicated cataract, metabolic cataract. It can occur following skin disease. It can occur following myotonic dystrophy or neurofibromatosis type 2, in Down syndrome, in electric or radiation cataract, and in toxic cataract. So these are the various types of acquired cataract, and each of this is very important for us to understand. So this is the congenital cataract, also called a developmental cataract. You can see that the congenital cataract is present in one eye, and this is called the Bruckner's reflex, where you can see that the reddish glow is present. So a very simple test that can be done in the OP when a child comes with this whitish opacity is to show a torchlight, and based on the uniformity of the red reflex that we can see, we can say whether the eye has a cataract or not, or any, for that matter, any lenticular opacity. So in this case, quite obviously you can see the red reflex in one eye and you can see a whitish reflex in the other eye. This whitish reflex is also called an amerotic reflex. So congenital and developmental cataract is very important because it can have far-reaching implications on the vision of the eye. Unlike the adult, where when we detect a cataract, we do cataract surgery and we remove the lens. In children, it can be different. In children, we have another big problem to worry about, which is called amblyopia. Amblyopia means there is a defective vision in one eye which does not have any organic cause. So usually defective vision can be explained by some retinal pathology, or it can be due to media opacities, but in when you say amblyopia, it refers to a condition where there is no organic cause. So in children, suppose the child has a cataract like this, we are removing the stimulus, the light stimulus to go into the eye. So over a prolonged period, when light does not go into the eye, the visual function can be very grossly affected. The development of visual reflexes is affected, and that can result in amblyopia. So we need to always remember that any child who comes to us with a defective vision in one eye, if we do not treat the cause immediately, the child can develop amblyopia. Now that is common to all diseases. In cataracts, in congenital cataracts, it is far more important because when the child has a unilateral cataract such as what you're seeing in the picture, we have very significant chances of amblyopia being induced, so we have to operate early. Congenital cataract is caused when there is a developmental delay of the lens in the embryonic or fetal nucleus stage. I already told you the embryonic is the innermost, and then that is surrounded by fetal. So when the lens is developing at this stage, if there is some problem, then we call it a congenital cataract. Developmental cataract is when there is a problem in infancy. So when the child is grown a little bit more, if there is a problem at this stage, that is infantile nucleus. In the infantile nucleus stage, if there is a problem, then you can have what you call we call it a developmental cataract. So when the child grows into adolescence, at this stage, if there is some problem with the development of the lens, we call it developmental cataract. So in other words, if the innermost fetal and embryonic parts of the development is affected of the nucleus, then we call it a congenital cataract. Congenital means embryonic or fetal, whereas developmental can be infantile or adolescent. So depending on which stage of the nucleus is affected, you give it a nomenclature. Commonly we call it congenital cataract because this is more likely to be present, but again it depends on the etiology. There are certain conditions that can affect the infantile nucleus, certain that can affect the fetal nucleus, and certain that can affect the embryonic nucleus. So that's what we'll be seeing now. Congenital cataract is disturbance that occurs before birth, whereas because it has affected the embryonic or the fetal nucleus. And the commonest cause of congenital cataract can be any of this: hereditary, idiopathic or maternal and fetal causes, and equally 1/3 of patients have hereditary causes, 1/3 have idiopathic causes, and 1/3 have maternal or fetal causes. But based on the morphology, the common cataracts, familial cataracts, can be cataracta pulverulenta or zonular cataract or coronary cataract. These are the three most common causes of familial cataracts.